So good night, welcome everyone to one of my webinars. Today we're going to be talking about a very interesting topic. I would like to remind you that your microphones are going to be muted throughout the presentation, and I will give you, we will give you some time at the end to ask some questions, which is my favorite part. I want to thank brightbot.com for sponsoring this webinars. These webinars come from my experience and Dr. Martinez's experience as doctors, but it doesn't replace medical consultation. If you have questions by the end of the webinar that maybe were not answered, or you're not watching this live, you may enter brightbot.com and record a video question, and me or somebody else will answer it for you. So let's begin. Today we're going to be talking about hypothyroidism and goiter. First of all, we have to understand that the thyroid gland is it's a butterfly-shaped organ that's located here in the throat. You can see there in the picture. It's in charge of the production of thyroid hormones, which are basically we call them T4 and T3. The term goiter refers to the abnormal growth of the gland. The functions are very, very different, but very there are lots of functions for the hormones producing the thyroid. Energy, thermal regulation, and some other. It works in every organ in the body. So just to see some numbers, about 20 million Americans have a thyroid disorder, and 60% are unaware of the condition because either they don't know it, they never got to a doctor, or maybe it's undiagnosed or misdiagnosed. So yeah, basically of those 2 or 3% have underactive thyroid, and the rest might have, some of them have overactive thyroid. But in this case, we're going to be talking about the percentage with underactive thyroid. Also, it's important to know that women are 8 times more likely to have thyroid disease conditions. You know, I always have my amazing facts. Here, I would like to tell you a little bit about the thyroid. It's basically 20 grams and about 3 to 4 inches, so it's a very, very small gland. But it has a very, very important job because it affects every organ in the body. If the thyroid gland fails, then your well-being will drop dramatically, or your health will drop dramatically. So it's very tiny, but very, very, very important. Thyroid hormones require iodine, to function properly. So here in the picture to the right, it's like a schematic of the thyroid hormone, and in purple you can see the 4 molecules of iodine that are attached. The T3, that is a hormone produced by the thyroid, it's basically the same basic structure with only 3 iodine molecules attached, and then it becomes active when you add the 4th iodine. So lack of iodine used to be in the diet used to be a public health problem many years ago, probably 50 or more. So in response to this problematic, table salt now contains iodine, not only in America, but in several other countries in the world. So maybe that's why you see, or maybe you've seen, that the salt contains iodine. It's not because it makes something to the salt itself, it's just that it gives the adequate dietary requirements of iodine in the diet. So not a lot of people know why the salt contains iodine. Then what is hypothyroidism? Well, of course, it's a type of thyroid disease. It's when the thyroid is underactive. So basically, it does not produce enough thyroid hormone. There are multiple causes for this. There are multiple origins of an hypoactive gland, but there are three main ones. First, autoimmune conditions, so the body attacks the gland. We call this Hashimoto's thyroiditis. The second one would be obviously the removal of the gland for surgical reasons. Actually, when the thyroid is hyperactive and you have hyperthyroidism, sometimes it is required to remove the thyroid gland. So these people were hyper and then they become hypo. And the third one is radiation. Thyroid is very, very responsive to certain radiation treatments. So, and radiation in general. So, basically, any kind of radiation, medical or not, will definitely affect the thyroid. I don't know if I think Dr. Martinez is here and she can speak. Those, can you continue?
Yes, can you hear me now?
Yes,
Sorry.
yes.
Excuse me for the problems. I don't know what happened.
Don't worry.
Talking about some risk factors, there are two main risk factors for hypothyroidism, and they correspond first of all the age. The incidence of this pathology increase with the age, and the main age is about 50 years old. Of course, as Dr. Mesa said before, women are in increased risk of having hypothyroidism. Besides the age and sex, your risk for having hypothyroidism is increased if you have a family history and relatives with thyroid disease or autoimmune diseases. Also, a history of thyroid surgery, any kind of radiation, as Dr. Mesa was telling to you, and lack of iodine in the diet.
And something I would like to add here is that besides the risk factors for developing hypothyroidism, there are also some possible consequences, or that hypothyroidism is itself a risk factor for some other conditions. Conditions, for example, in the heart arrhythmias are more common in patients with hypothyroidism, especially very slow heartbeat that sometimes might be so slow that it might need a pacemaker or some kind of medication for it. It's also a high risk for some other autoimmune conditions like lupus, psoriasis, and arthritis, for example.
What are the main symptoms of hypothyroidism? Hypothyroidism doesn't have any characteristic symptom. There are no symptoms that people usually have as a main symptom, because some symptoms can occur in people with other diseases. Underactive thyroid gland means that your metabolic body is decreased, so your activities slow down, and the main symptoms are generally symptoms like dry skin, loss of memory, tiredness, loss of your hair.
And we have to talk about the goiter itself. Nowadays, goiter, it's a presentation that is not longer seen as it used to before, because the main cause for goiter was the lack of iodine as in the diet, as I mentioned before. So basically, when we don't have enough iodine, the hormone is produced, but is not produced to be effective. It doesn't have the 3 or 4 iodines that are required. So in response to this, the body will try to enlarge the gland, so thinking that maybe by producing more hormone, it will basically solve the problem. But the thing is that it doesn't matter how big the gland is, if we don't have iodine, then it will produce a hormone that is not really effective. So it will continue growing and growing. This is something that used to be very common in the past days. Now it's not so common, but we still see it at least for a very short period of time with certain thyroid conditions, but it's not as it used to be. Like if you ask your parents, maybe in those days, this was more common.
So now there is an interesting topic, specifically for women, and let's talk about thyroid and weight. You know that metabolism, that thyroid gland regulates metabolism, and how we can measure that. We measure that with the basal metabolic rate. The basal metabolic rate means the amount of oxygen that the body uses in a certain amount of time. The basal metabolic rate is usually measured also with energy balance. The energy balance means the calories that we take minus calories that the body use. So the metabolism determines how quickly you burn calories. So if you have hypothyroidism, you used to uh, do not burn as quickly as you normally use calories, so you get fat. It is important to know that just 5 to 10 pounds increase of body weight when you have hypothyroidism.
Yes, this is actually one of the things that patients ask more frequently, or why they go to the doctor is because they're either having difficulties losing weight or are actually gaining weight, and they have heard that thyroid conditions are related to weight, so they want to know, do I have a thyroid condition? So yes, definitely it is related, as Dr. Martinez was saying, but we have to remember that if you are gaining weight because of a thyroid condition, it's not going to be a lot of weight. And usually it's not something that is typical in every patient. It's more than it's more typical in women, so maybe it's more associated with gender and not necessarily with the thyroid condition itself. So, but yes, this is really important. Hypothyroidism causes slow metabolism. It basically slows everything down, including burning calories.
How we usually do the diagnosis of hypothyroidism? It talks about two main topics. The first, and I think the most important, is the medical and family history of having hypothyroidism. Medical history and symptoms are quite important, as we were talking about before. And we have two blood tests that are the most important. One of those is the measure of TSH, and the other one is the measure of T4. TSH means thyroid stimulating hormone. This is the most important and the most sensitive test for hypothyroidism. TSH measures how much of the thyroid hormone or T4 the thyroid gland is being asked to make. So it is quite important. Um, it is important to know that TSH levels are inversely proportional. So if you have abnormally high TSH, it means you have hypothyroidism. It means that the thyroid gland is being asked to make more T4 because there isn't enough T4 in the blood. It is important you to understand that.
Yes, that's something that some patients, when they receive their test, they're not able to interpret the test. Okay, so yes, it's basically the opposite. If you have a high TSH, you have hypothyroidism, and if you have a low TSH, that means you have a hyperthyroidism. It's a little difficult to understand, but that's the way it is. And of course, the ultrasound is very, very, very important because it let us know whether this condition that you have is something with that's that might be either malignant, which is very, very rare, but we can see it, and also if you have nodules or something in the thyroid that might be overacting or underacting. So it is basically blood tests and ultrasounds are the most commonly used. And of course, yeah, here you see your TSH and the T4. That's basically what your doctor will order.
How is hypothyroidism treated? It depends of the cause. if you have a viral hypothyroidism, uh, your thyroid function return to normal. But if you have an autoimmune cause, usually there is no cure for hypothyroidism, and most patients have it for life. But it can be cured, but usually can be completely controlled with the replacement therapy with levothyroxine, that is the replacement of T4. Another manage, of course, is with the diet and exercise as a complement manage of this condition.
Yes, unfortunately, I mean, fortunately and unfortunately, it depends how you see it, but basically patients that are hypothyroid, they will require a hormone replacement for the rest of their lives. But let's say that is a very simple, I mean, the hormone is in tablets, and it's very simple to take it. It is somehow important that you do it in the morning because, of course, in the morning is when physiologically the gland produces more of this hormone. So we try to do it in the morning. Of course, it takes a little time for us to actually know how much hormone do you need. It also depends on every patient. So what we do is we give a little amount, and then we start measuring every 2 to 3 weeks the TSH until we get to normal levels. But the good part about it is that when you receive the treatment, basically you're going to get rid of all the symptoms and you're actually going to feel very, very well. So it's very easy to treat. And even when a lot of people have it, uh, let's say that it's relatively easy to treat. Difficult or almost impossible to cure, but to treat it's very, very easy.
There is also important to know that there are not much side effects with taking levothyroxine. The only dangers of taking those drugs may be taking 2 liter or too much dosage of levothyroxine. So it is important to get the dose controlled by your doctor, as Dr. Mesa was telling you.
Yes. Okay. Well, thank you. Thank you all for listening to the presentation, and of course, thank you, Dr. Martinez, for presenting with me. So this is the time that we will give you for some questions. So go ahead. Thank you.
Doctors, can you hear me?
Yes.
Okay, got a question. What would happen if you would have taken too much iodine? Because I've always wondered about that when I see the iodized salt, and I'm wondering what would happen if I had an overdose of iodine or was taking too much into my system. Would that have any effect on the thyroid?
Not on the thyroid. I mean, iodine is very, very let's say that innocuous. It's not doesn't have a toxic, or is not as toxic as many other things. Basically, the thyroid gland knows whenever we have too much of iodine and simply doesn't use it, and it goes and passes through. So it's very, very difficult to actually have an iodine, let's say, overdose. So not really. So it is safe to consume the iodine that comes in the salt.
Okay, thank you.
You're welcome.
In older people, they naturally, their metabolism slows down. Having this condition would, I would like to say is, does this affect them in any way that, and it could be just because they're getting older while they're slowing down, or it could be a thyroid issue in an older person. Let's say somebody that's 80.
80? So
80 years old.
So you want to know if an 80-year-old patient is his metabolism and his energy is kind of wearing down. You want to know if this might be because of hypothyroidism. Is that your question?
Yes.
Okay. Well,
how would you determine, what it is? If it's age or it's just the hypothyroidism?
Uh,
Well, Dr. Martinez, yeah.
okay. As we told in the presentation, it depends on much factors. Maybe if you have a family history of autoimmune disease, or maybe a family with hypothyroidism, it should be a risk factor. So you should be aware if you're having slowing down your metabolism and you have also the family history. And of course, if you have some symptoms that of maybe if you're getting tired easily, and all the symptoms we told you, and they are usually related to having hypothyroidism. It will be normal with age.
Yes. So basically, what we do is that if the patient, because some of these symptoms, as Dr. Martinez was saying, are both present in people with hypothyroidism and also people that are normally aging. So basically, we take all of what we mentioned: family history, physical examination, and other symptoms, and we might suspect. So basically, we have a patient that has some history or some symptoms that's suggested. We basically run some blood tests. It's as easy as that, and it's very simple. So basically, this is one of the lab tests which is done more frequently. So that's the only way we would be able to know. I'm going to add some other symptoms that might be present in case you didn't hear them or they were not there. So dry skin, loss of hair, loss in the quality of your fingernails, having constipation or difficulty with bowel movements. Is everything slows down, so that's also one of that. You might have some memory loss, and of course some fatigue, some intolerance to cold. So this kind of people, this patients always want to be covered or in indoor, or don't like air conditioner. So if you have this, no matter what's your age, 80 or 30, we will run tests to know.
Thank you.
You're welcome.
So doctors, if if someone has had radiation for throat cancer, it is likely that they will develop hypothyroidism?
You said for thyroid cancer?
For throat cancer.
Oh, for throat, it is possible. It is very, very possible. Not only because of radiation, you might suffer some side effects, including the burning of the esophagus, which is the part where the food passes through. So you might get that. You might get your vocal cords affected. So you might get a little hoarseness in your speech, in your voice. But yes, hypothyroidism is a possibility. I don't know if you have seen this, but even when we do simple X-rays, not only we wear the lead vest, but there's also a special part for the neck. It's especially designed to cover the thyroid. So it's very, very, very susceptible to radiation damage. So yes, it is definitely a possibility for patients receiving radiation for throat cancer, yes.
And also, it depends on the dose of radiation. So you will have maybe a mild hypothyroidism or a high one. So it depends on, but of course, it is quite related with radiation. Yes, you will need to replace a replacement therapy.
Yes.
Okay. So for the hypothyroidism, that would have to be blood work taken to see your blood level, whatever it is that you need to test for. Would it have to come from labs?
Yes, that's the mostly, and the first tests that we do is basically the levels of the T4 and the TSH, which is the hormone that stimulates the thyroid. Actually, that's what it means. Thyroid, stimulating hormone. So that's the first we do. If we do find that there's hypothyroidism, then we do some other tests to determine whether is it because of lack of iodine, is it because you have an autoimmune condition, so we run some other tests, is it because you had radiation. So but the basic test, the first one is the TSH and the T4. That's like routine.
Okay. And for the lost my, I'm sorry. For the what is the medication? Lorotidine?
Levothyroxine?
Levothyroxine. You would have to go to the doctor, have a test done each time to make sure that you finally get the correct dosage of that medication.
Usually when you get new doses or changes in your dose, we usually take TSH and T4 levels each 3 to 10 weeks just to control the levels of your thyroid hormones until we get to a balance. Usually this is the treatment.
So okay. Yes. It's not something that you're gonna have to do every month. Just at the beginning of the treatment, just to get the levels right. And every time you have or you feel like you're having some symptoms again, so maybe we have to increase the dose. Those are the only times we do it. But at the beginning, we do it a lot, every 2 to 3 weeks, and then we just keep it on that level, and we don't run the tests probably once a year or something like that.
Okay. All right. Thank you.
You're welcome.
So I know you said that the iodine has a very large role with the thyroid. So are there any like foods or maybe lifestyle changes that people need to do in order to prevent hypothyroidism, or maybe they have to do it after they are diagnosed with hypothyroidism?
Well, I mean, the diet that we have, it's important that we include iodine. But as I said, now some foods that are very, very widely used contain iodine, being table salt, the most common. Sea salt didn't have iodine before, but now we have it because a lot of people were changing, because now everyone wants something more natural, so they were consuming sea salt. And again, we were seeing the same iodine deficiency. So now it contains iodine. That's the only thing you could do to prevent it, as far as nutritional things you could do, because the rest of the causes are basically out of your reach or your power. So it's genetical. So just have a diet rich in iodine, and that's it. And actually, the iodine quantities we require are not very high. I mean, with normal consumption of salt, we get more than what we need. So it's not that, cause it's not very common nowadays. So prevention is not needed. The only thing regarding prevention are personnel that work with radiation, like I was saying, to cover the thyroid, because a lot of people don't do it. X-ray technicians or CT technicians, they just cover the chest, but the neck is very, very important.
Yes, let's say that exercise and food changes are just recommendations that we usually do for the treatment to help to get milder symptoms. But yes, as Dr. Mesa says, just iodine and prevent radiation should be the only ways to prevent having hypothyroidism.
I have a question. Would you say that hyperthyroidism can be more dangerous than hypothyroidism?
Yes. Well, hypothyroidism is a condition that might slowly kill you, but there are very few cases reported, because the symptoms happen so slowly, so gradually, that somebody usually catches it. The thing with hyperthyroidism is that sometimes you're not able to detect it as fast. And there's a special condition, and I will talk about it more if I can do a hyperthyroidism webinar, but there's a condition called thyroid storm, in which basically, and for no apparent reason, the thyroid decides to produce twice, 3 times, 4, 10 times the normal amount of hormone, of thyroid hormone, and then you will start having arrhythmias or cardiac arrest. You will have something similar to fever, but it's called hyperthermia. You will have basically everything in your body will shut down because the metabolism is so fast that it might kill you, and it's dangerous. It's an emergency, basically. So in a certain way, hyperthyroidism is more dangerous than hypothyroidism. Yes.
So with the thyroid storm, is that a situation, is that an emergency that would happen only once, or is that something that a person, once they experience, would be susceptible to experiencing it over and over again?
It might, yes, Dr. Martinez?
Yes. If a person have one episode of thyroid storm, it means that maybe he's taking the medication wrong and is taking too much levothyroxine as a cause, and of course he could have another episode, and it is a life-threatening one. Yes.
So yes, because that could happen actually. People sometimes, because this levothyroxine, sometimes people take it to lose weight, which is not very recommended, but they use, and they overdose, so they have a thyroid, like something similar to a thyroid storm. So yes, that could happen again if you just are taking the wrong dose. But also naturally, if you're hyperthyroid, basically it can happen again once you have a thyroid storm. So basically, in both cases, you are susceptible to have it twice. Yes.
And just one more question, if you don't mind. You showed an image with, I guess it's what happens when people have goiter, but in front of their thyroid, their neck was like swollen like that, like and so once that happens, is there any way, can the treatment reverse that, or are they stuck walking around like that?
No, the treatment reverses. Even some cases like that, which are not very common and a little like the worst case you could have. But yeah, taking the iodine sometimes, or just replacing the hormone, will reverse it almost in almost all cases back to normal.
Yes.
Thank you.
You're welcome.
Doctors, got a question.
Yes.
I've heard, you probably have heard, like somebody who would be maybe overweight and they're not really eating excessively, and I've heard people mention the fact that maybe they have a lazy thyroid or something like that. Question is, how is there any truth to that, and how common is that?
At least the consultation for that being the chief complaint is very common. I'm gaining weight or I'm not losing it, and I have a normal appetite, and I'm eating what the rest of my family is eating, and I'm the only one who's fat, maybe. So it is more common as a consultation than actually common as the real presentation of hypothyroidism. Like we said, if you're gonna gain weight because you have hypothyroidism, it's gonna be probable that you're gonna weigh, as Dr. Martinez said, 5 or 10 pounds in your life. It's not that you're gonna do it in a month period. So it is not really that common. We might suspect it. It might be one of the symptoms, but you have to have some others, slow heart, or constipation, or thin hair, or some other. Just the weight, it's not very likely to be caused by the thyroid. I don't know, Dr. Martinez, if you think in your experience, your patients that are gaining weight, do you really think that's a very good sign of hypothyroidism?
No, really not. As I told you, the mean weight gain is like 5 to 10 pounds. It is not too much. So usually there are another factors that are contributing to the weight gain. And as Dr. Mesa says, you have to have another symptoms to suspect having hypothyroidism. This is not the only one. and it's not the most sensitive one.
Yes, so it's kind of a myth that was born from some truth, because you can gain weight, but it's not usually the most common symptom. Okay,
Yes.
Okay, thank you.
you're welcome. Okay, thank you everyone for your attention, for listening, for your questions. That were great. Thank you again, Brightbud, for sponsoring this webinar, and thank you, Dr. Martinez, for being here.
Thank you, Brightbud, and see you next week.
Thank you. Good night.
Night.
Okay, have a good night.